Hi, my name is AlexandraBroe, and today the contemporary issue that I will be discussing is the impact stress plays on Australian new graduate nurses, which may over time cause burnout and fatigue, thus compromising patient safety and a healthy workplace. The World Health Organization, WHO, defines stress as the response people may have when presented with the demands and the pressures that are not matched to their knowledge and abilities and which challenge their ability to cope. Stress is inevitable, however, the inability to cope with the challenges and tasks may cause long-term issues related to nursing burnout and fatigue. Fatigue being defined as mental exhaustion caused by worrying or the difficulty in coping with a situation in life, a chronic feeling of lack of motivation or energy. The stress and responsibility of caring for patients is part of the motivation to do our best. However, nursing burnout is when this stress evolves into emotional and physical exhaustion. In order to elect an appropriate leadership style to combat the effects stress plays on new graduate nurses, it is first important to reflect on what the problem is, what is currently being done, and the overall significance stress plays on patient safety and healthy workplace. New graduate nursing stress becomes a contemporary issue as for myself, it is going to be a major concern next year as I commence my new graduate position. With reference to an AusMed article published in 2015, workplace stress has long been discussed by experts, and amongst a group of nurses, they are able to identify 4 major causes of stress. This being patient care, decision-making, taking responsibility, and change. These 4 combined, leading to fatigue and burnout. However, despite highlighting these 4, there continues to be increased levels of stress amongst new graduate nurses. The new responsibilities that are placed upon new graduate nurses can often be intimidating and stressful. You are coming from being a student nurse that is always supervised to having a full patient load, not being used to the fast-paced hospital environment, and the new responsibilities can lead to burnout and fatigue. This is evident in the WHO definition above, as often the new graduate nurses' demands and tasks are not matched to their knowledge and abilities, leading to the human instinct to just shut down and no longer be able to cope with the stresses associated with being a nurse. The stress of being a new graduate nurse and the change that comes from being supervised as a student nurse and not being used to the fast-paced environment can eventually lead to fatigue and can compromise patient safety. This can lead to medication errors, poor communication with patients, and poor time management. Within the New South Wales Health Policy on preventing and managing work-related fatigue, they present the associated risks with stress-associated fatigue. These being a reduction in work performance, reduction in productivity, increased risks of work-related OHS incidents, and increased risk of possible adverse outcomes for patients. Stress can lead to fatigue and burnout, which may alter new graduate nurses' performance. This may affect communication and relationships between nursing staff and other multidisciplinary teams, ultimately disrupting a healthy workplace. Within a cross-sectional study conducted by Alexandra and Fide, burnout was significantly impacting on mental health and job dissatisfaction, thus contributing to a disrupted, healthy workplace. In reference to the article, New Graduate Nurses' Experiences in Their First Year of Practice, the experiences new graduates have in their first year of employment will significantly impact their future career direction. So, the significance. The significance of stress amongst new graduate nurses is that I myself will be a new graduate nurse next year. It is a crucial stage that all nurses must fulfill to allow personal and professional career development. The negative effects on stress can disrupt a healthy workplace, and therefore it is also important for nurses to understand the occupational health and safety legislation. Within Section 8 of the OHS Safety Act 2000, it states that we, the employee, are responsible for providing patient safety and must be aware of the psychological risks that are a result of this stress caused by caring for our patients. Recent WorkCover New South Wales statistics conclude that stress is amongst the most common workplace hazards for nurses and can lead to adverse effects for patient safety and a healthy workplace. So what is currently being done? By looking through current New South Wales health policies in conjunction with systematic articles, it is clear what is being done. In reference to the Australian Nursing and Midwifery Federation, they encourage those experiencing stress to report to management and health and safety representatives to form plans for prevention of work-caused stress through advocacy, education, and support. As stated above, continuous stress can lead to fatigue. Therefore, New South Wales Health have also created a policy directive on how to successfully overcome the effects of fatigue. Employee assistance programs are often set in place, which offer workplace counselling for any nurses suffering with the negative effects of stress, mental health issues, and issues with organisational change. So, can leadership solve work-related stress or migrate this problem in some way? Yeah, well, a large part of potential stress for nurses appears to be organisational in nature. Therefore, a ward or team leader, their leadership style can and will help reduce stress amongst new graduate nurses. In an empirical study conducted by Bonnie Jennings in 2008, the relationship between staff and team leaders indicate that supervision support and the quality of supervision affects both staff burnout and managerial stress. It is evident that both organisational and interpersonal resources appear to play a protective role against early career burnout and development over time. Therefore, team leaders can ensure that stress is minimised by having rosters that have appropriate skill mixes, new graduate nurses being paired with more experienced RNs, ensuring all staff are aware of policies, procedures, and expectations regarding rostering and leave, which can cause some stress, ensuring new graduate nurses have appropriate breaks during their shift, and ensuring staff have access to support services, and these include employee assistance programs or clinical supervision. By adopting a transformational leadership style, NUMs and team leaders can work alongside staff to identify goals, implement change, and reduce the effects of stress. Therefore, ongoing encouragement and support by leadership needs to be focused on providing safe environments in which new graduates can speak in confidence if they are feeling stressed or burnt out in any way, thus allowing patient safety to be fulfilled and promote a healthy, open workplace based on effective communication. It is also evident in a systematic review that transformational leadership, trust in leadership, and management support were associated with reducing medication errors in 4 out of the 5 studies. Therefore, increased patient safety whilst concurrently promoting a healthy workplace in nursing units, which are based on respect, teamwork, and collaboration between nurses and other healthcare professionals. So, how is it related to new graduate nurses? Well, this contemporary issue relates directly to new graduate nurses, as according to the NCSBN, approximately 25% of new graduate nurses leave a position within their first year of practice because of issues directly related to stress. The stress of transition and the shock associated can often lead new graduate nurses focus more on completing tasks and time management than providing person-centered holistic care. And as I've stated above, we are new graduate nurses next year. This will be us, and this will be one of our top priorities. So, how is it my responsibility as a new graduate nurse? As a new graduate nurse, it is my own responsibility to know the policies or procedures within the hospital or local health district that deal directly with stress and managing the burnout and fatigue associated. From undertaking this subject as well, I can also conclude that we are all team leaders and we can all play a role in managing stress, speaking out and providing education. It is our responsibility to remain in our scope of practice and to form our own coping strategies and to ask for help when needed. Some coping strategies to deal with the stress include mindfulness exercises, journaling, relaxation techniques, setting realistic goals for the day, sharing any worries and concerns with other staff, friends, and team leaders, and remembering that stress is a part of every day. It's what motivates us during the day and what gets us through the day. So, the importance of an authentic leadership style is evident in the research above, and has shown greater levels of job satisfaction, increased commitment to an organisation, and decreased turnover of staff, thus relating directly to patient safety as decreased emotional stress and fatigue, increases patient safety, patient health outcomes, and thus promoting a healthy workplace with patient-staff relationships and relationships between multidisciplinary teams increasing. This PowerPoint will hopefully demonstrate a detailed understanding of the new graduate registered nurse's experience surrounding stress and the impact it has on patient safety and a healthy workplace. This can be used to implement a transformational leadership style within the workplace to provide relevant information and education during the new graduate year to reduce the impact stress plays on burnout and fatigue. Thank you all for listening, and I hope this presentation was effective in some way.